Hi, my name is Rahasya, and I'm from Lotus Guide. And today we're going to be interviewing Harvey Beglesen. He wrote a book called Holographic Blood. Now, the first couple times I heard this guy talk, it was really difficult to wrap my head around this. But if you're familiar with Dr. Emoto's work and some of Bruce Lipton's work, and physicists at large, you will know that the universe, the best possible explanation on what all of this is, this reality, you, me, everybody, everything, is that it's a holographic projection. Now, it only stands to reason if this is true, and some of the smartest people on the planet say that this really looks like it's the case, then we need to pay attention to new theories and new ideas and new therapies. And Harvey's information is really curious because it is totally pointing us towards a holographic projection in our blood to see what's wrong with us. So let's listen to see what Harvey has to say. And thanks for tuning in. So Harvey, tell me a little bit about yourself. And first of all, let me tell you something. I first became familiar with you from Bruce Lipton. Him and I were talking one time, and he told me all about you. And I've caught a couple of your lectures. So I'm a little bit familiar with your work. But tell us a little bit about yourself, a little bit about your history. And eventually I would like to sort of open this up to the holographic universe theory in general.
Okay.
Okay? So Tell me a little bit about yourself.
Well, I am an MD. I was a trauma surgeon in Vietnam. I gave up traditional medicine, in the mid-'70s because I got really frustrated that only using pharmaceuticals and surgery. And I started to look for other answers. I started to look for natural medicine and how to really help and improve the body. And that's been my work for a number of years now, how to regenerate the body. I was sponsored by a private foundation about 30 years ago to go to Europe to see what they're doing. And we ended up outside of Quebec at a French-Canadian physicist's office, Gaston Naissons, who had a microscope that he looked at the live blood. And I've never seen the live blood. I'm only the third American in U.S. history that's actually looked at a drop of blood under a microscope without staining it, that was living. And there were things that were moving in the blood that just blew me away. There was no name for it in American literature, lots of activity in the blood. And I knew it had to be important, okay, because this is the blood, this is the life of the body. So I got myself a microscope and I started to look at it and study it. And I found a German physician that worked on an Indian reservation that was doing this type of work. And my son had acute mononucleosis at the time. He was going to go off to school on Saturday. On Monday, he had 104 temperature. His tonsils were green, swollen, shot pus. His liver enzymes were abnormal, and he had positive mono test. Well, mono is a 6-month disease. We figured he couldn't go to school, but we called this German doctor down, and he had a microscope, and he studied the blood, and then he took out his magic penicillin, injected my son into his tonsils, and then he took some blood out, mixed it with a remedy, and injected it back into his butt, and he said, okay, now he can go to school. Well, we were stunned at what he was talking about. And the next day, though, however, my son woke up. He sweated up all night long. Next day, he had no temperature. His tonsils were 70% pink. Day after that, they were 100% pink. On Friday, his white blood count was 6,300. His mono test was negative. His liver enzymes were normal. He off to school. He went on Saturday, and I called that German physician out and said, okay, you've got to teach me what you know how to do.
Right.
And that started my journey of looking at the live blood and understanding what that's about.
And that's usually what it takes. It takes some personal passion to go off in a direction like you've gone off in, because I would imagine that this hasn't been easy, because you don't look like the kind of a person that could be put in a box. And
No.
when you're dealing with the medical association and the government agencies, it has to be a lot of resistance to what you've done.
Oh, I've met tremendous resistance from the system. In fact, I wrote the Arizona Homeopathic Medical Practice Act, allowing MDs that were being persecuted for alternative medicine to go under their own licensing agency. And I was on TV and I was in the news, and well, the state we controlled, but the feds then came after me. In fact, I got it one day. I was solicited by Medicare. They came into my office to sign me up. They never, ever do that. I was naive at the time. Well, since I was doing so well in practice, I signed up to Medicare. Within a month, I got my first check from Medicare, and all of a sudden, I got a random Medicare audit. I was one of 3% of physicians picked out for a random audit. They randomly picked out 28 cases out of my several thousand files. Those 28 cases all involved something called chelation therapy, something I never did in my entire career, but I had a guy that worked with me for 3 months. Those are his 28 cases. This was their random pick. At the end of 3 months of an audit, they said, you know, your procedures don't fit our codes. Why don't you code it this way? And they told me exactly how to code it. 3 years later, they had grand jury hearings on fraudulent coding. After 3 years of grand juries, they indicted me on 117 counts of Medicare fraud, totaling $3,500. The lowest indictment in U.S. history. At the same time, Senator Bill Frist opened up a series of HMOs, and he got a Medicare fraud misdemeanor for $1.7 billion, which he paid off in 2 checks. I got an indictment for $3,500. It would have cost me up to $1 million just to defend myself. So we plea bargained to $145, and I had to give up my licenses and get out of the country. So that's a lot of my history with the U.S.
Well, it's been a gift to the rest of us because it's taken you down a path of discovery.
Yes.
You know, and don't even get me started with the government and the Rockefellers, how he buried homeopathy. And I mean, this has a long story of government and certain people intervening to direct us into allopathy, and it's been a dangerous road. I mean, as a surgeon, you must know this.
It's very scary. Rockefeller started off in 1910 by sponsoring the AMA. At that time, there were 5 different types of schools that were healthcare schools. They all lost their charter by 1947. Flower, Fifth Avenue, and Hahnemann Medical College became allopathic schools. They lost their homeopathic charter. And Rockefeller himself died at the age of 97, a vegetarian all his life, a homeopathic physician in attendance, and never taken a drug into his mouth. So that tells you a lot about the story of what
right.
That is. And the persecutions that have gone on have been absolutely incredible. If they can pick out 28 cases out of my 5,000 files, I mean, they're spying on us. That's very, very frightening.
Yeah, and it's getting progressively worse. You know,
yes.
And this is why, you know, while we still have some freedom, this is the importance of things like this, putting things like this on the internet. We still have a few avenues of free speech, and this is one of them. So tell me, what is the difference between traditionally looking at a drop of blood and do you do, what is it, dark field?
I do dark field analysis.
Right.
But some people do something called live cell analysis, which is a lot of baloney out there you can learn in a weekend. It took me several years with 2 different German practitioners as an apprentice to them. I can take a drop of your blood and I look at it in the dark field microscope. And when I look at it, there's a lot of things that are moving around, a lot of activity that there's no name for in American literature. There are little things that move around, and you can see some of my videos on the internet. There's little things moving around. The Germans call symphritites or symbionts. The French call somatids, and the Americans have no name for them. And those little things, they carry the chi, the ki, the prana. They actually carry the life force of the body. They're pieces of protein that can develop into bacteria, into fungus, depending on the pHs and the media and the cultures are. There is a French-Canadian physicist that I first saw with Gaston Naissons. He actually isolated these little guys, grew them in a jar, and he took a dead rat muscle and he injected it to the dead rat muscle, and 30 years later that rat muscle is still beating in a jar. Okay.
Yeah.
And there's no concept in American stuff. Americans, they remind me of the moron that lost a quarter on the dark night, looked 2 blocks down the street because that's where the street lamp was. You know, I once had chief of hematology from Tufts New England Medical Center in my clinic, and he refused to look at the blood. He said, "Why would anyone look at the live blood?" It's the chief of hematology of a Boston medical school. Refused to look at the blood. His curiosity was astounding.
Yeah, this sounds like it would be a good base of understanding for looking into why people are even sick, because I remember Bruce Lipton telling me, he says, one of the things wrong with medicine today is it's so highly specialized and complex and compartmentalized that nobody's connecting. And everybody can connect with blood.
The name of the game is a name today in medicine. You got to put a name on it,
Right.
puts in a box, and then you open up the box and it tells you what to do. American medicine hasn't found the cause or the cure of one chronic disease in 100 years. Well, what makes these experts on TV? How can you be an expert if you're a 100-year failure? Do you know how low we rank in the World Health Organization? We're number 37 in the World Health Organization. French are number 1. Okay. What makes us so good? There are countries ahead of us, if you look up the World Health Organization, that you've never heard of. And they're ahead of us in healthcare. It's amazing. It's brainwashing.
Yeah, we have a lot of friends. My wife is from Brazil, and we have a lot of friends in South America and Europe. And it's amazing when you get out and travel to see a few things. One is how our news, our media news, our corporate news is so filtered down.
Yes.
But our public services, even public transportation, is so poor compared to some countries that it's incredible. We had some friends come back from Holland last week. They went to the Alternative Energy Conference. And they came back and they said, my God, how these people are so healthy. I said, well, yeah, they're probably just not obese. He said, yeah, they all ride bicycles, and you see them riding a bicycle with their briefcase and their uniforms on. They're into it, you know?
Oh, let me just look at the French. The French eat like crazy, drink like crazy, smoke like crazy, and they're thin as rails, and they live 5 to 8 years longer than us. Okay,
Yeah.
look at us. We're so obese, it's absolutely unbelievable. We eat meals in 10 minutes while watching TV, all this garbage with labels on it. The French eat fresh foods. They eat it over 2 to 3 hours. The day is over. They relax back. And, I eat like crazy, and I'm really thin because I eat over an hour and a half to 2 hours. I take my time. I chew my food. I don't eat American style. And that, I think, is one of the big problems with us.
Yeah, the first few times we went to a restaurant up here, we were sitting with my wife, and the waitress keeps coming up and say, "Are you still working on that?" And it just affected her. Like, what do they mean? Eating isn't working, and why are they pushing us to eat this and get out?
Yeah, and it's like the French chew the food. I tell the people, chew your food at least 40 times. If someone does it 20, great. Okay, we should mulch up our food in our mouth. Okay, and then let the enzymes break it down. Not us Americans. We take 2 bites, swallow the food, we're into the next bite already over there.
And that's because there's enzymes in our saliva that aren't in the rest of our body, right?
The saliva enzymes are around, the pH is around 6.4. The pH of the stomach is 1. So you got to mulch it up in the mouth first before it goes down to the heavy acid, would break it down to all this stuff. The stomach doesn't have teeth in it to break down your food.
Right.
Okay, we have our teeth for a specific reason.
So, Harvey, let's get into the holographic universe thing for a moment, because I see you as a pioneer. There are people that, for whatever reason, they're standing on a higher place and can look a little further over the horizon. And early in this century, people like Bohm, and later on Michael Talbot wrote the holographic universe. And
yes.
now they've been coming up with experiments like the GEO 600 experiment. They were actually looking for gravity waves, but more and more evidence is supporting the fact that there is no out there. And it seems to be an interference pattern if you could see it without seeing it, because it's the act of observation that changes a wave into a particle. It's as confirmed by the double slit experiment. All of these things are adding up to the fact that it seems like within each little tiny fragment of our universe might be locked in all the information for everything in the same way as a hologram. And I think this is what you're saying about blood, is when you look at one blood cell, within that blood cell, you can see the entire body and what's wrong with it, right?
You see, it's not looking at the blood cell, it's looking at a drop of blood.
Okay.
The cells in the blood, the red cells, there's white cells and things, and platelets in the blood. But also there are a lot of things that are moving in the blood. There's a lot of life going on in the blood. It's so busy, it's incredible. I've been looking at the live blood now for at least 30 years. And if a woman is pregnant, you will actually see pictures of the baby in the blood. I have pictures in my book, The Holographic Blood.
Yeah, I was seeing some of here. I was seeing some of these pictures in here, and that's what I was going to ask you. It doesn't look like it's actually in the blood cell. You're looking in and around the blood cells, right?
Right. These images are called symplasts by the Germans. The Germans just count them. I had one German practitioner, though, showed me, wait a second, look at the shape and look exactly what that means. And you see in that book, you see the pictures I love in that book of the pregnant woman. And you can see the fetus in the blood matching it to the sonogram, which is absolutely incredible. And every drop of blood, if you're angry, it's in every drop of blood. If you're crying, it's in every drop of blood. In acupuncture philosophy, every organ's got an emotion. The lungs are sadness, the kidneys are fear, the liver is anger. So if you keep an anger in, you'll actually see pictures of the liver in the blood. And if you've been keeping the anger in now for 20, 30 years, you can actually see the difference between you just got angry just today. There's very differences. And I've been studying that for years, and the accuracy of it, I can tell from a drop of blood probably more about your life than you would honestly believe. If something happened to you at the age of 5 and you never got over it, it's in your blood still, which is absolutely amazing. Everything is there.
Well, we're going to have to do this someday. We come to Grass Valley in Nevada City once every 3 months at least to help distribution of our magazine. So maybe we can get together, because there's something I want to talk to you about someday, but I can't even mention the guy's name in public. But he's a researcher that has to do with blood and cellular development.
Well, if you start to talk out of the box, they really come after you. I once had charges brought against me in Arizona that I cured a person with an illegal means. The head of the board said, we don't care if your patients are getting better or worse. We only care if you're doing the work in our way scientifically.
Well, this guy was threatened with 40 years imprisonment, and they completely devoured his finances a couple of times in his life. He ended up moving to Mexico and building his fortune back, because he's a really smart guy. But what he's doing is they're afraid of it. They're afraid of anything that would cure people or make them healthy. I remember talking to an old doctor it's been about 20 years ago, and he was about 80 years old, and he was telling me, he said, when I first started in the medical profession, whenever somebody would come in the hospital, it was almost a given that they would get a colonic. But the American Medical Association found out that people were getting healthy too quick from just having a colonic, so they stopped doing that.
Not uncommon. I love China best of all. China, the physician is paid to keep you healthy.
Right.
And if you get ill, the doctor must make daily house calls until he gets you back into the workforce.
Yeah, that's the way to do it.
We have a total different system. Everyone makes money on disease, so the sicker you are, the more money everyone makes. That's the name of the game. And again, our cure rate is zero. Zero. I've held that challenge out now for at least 20 years. Can anyone name one chronic disease that American medicine has found a cure for? And the answer is zero. So what makes you an expert if you're at 100-year failure?
Yeah, it's crazy. We have a friend that's getting ready to do chemotherapy, and I can't really make a decision like that for them, but just the fact that chemotherapy, I'm not sure if it's ever cured anybody.
Well, I don't throw the baby out with the bathwater, but I can use chemo in certain ways. But cancer's a mold. They think it's cancer is one cell that goes wild, grows into a tumor, and then breaks off and gets through the blood vessels and goes different places. Well, breast cancer only goes to the bones because it's a mold that feeds on calcium. When they gave women all this hormonal therapy for menopause, and then they gave them calcium for osteoporosis, they skyrocketed breast cancer. You can actually measure cancer by the pHs of the body. The cells are too acid. The blood is too alkaline because it's dumping alkaline wastes. And there's poor oxygen. And when you have it set up like that, cancer will develop.
Doesn't it seem to have a lot to do with inflammation, too?
Inflammation is the key to chronic disease. If I cut you, the body will heal itself by creating inflammation to heal it. Okay? You injure yourself, the body creates the inflammation to heal it. However, the biggest problem is what I call trapped inflammation. If I do surgery on you, the body's now going to try to heal it, but now there's a scar in the way, there's adhesions in the way, and the body can't get at it. So the body's like a wind-up toy that keeps on bumping against the wall and slowly burns itself out. Trapped inflammation is the biggest cause of chronic disease. Lyme disease today, it's rampant. It's epidemic. They blame it on a germ. It has nothing to do with a germ. 80% of my patients with Lyme disease have had some type of surgery in the year before. And surgery is, I look at the body like a 8-cylinder car built by God. Well, they took 2 or 3 cylinders and threw it away. So now you got chronic fatigue. You're getting 10 miles to the gallon instead of 20 miles to the gallon. The moment I treat the surgical area, all of a sudden they're getting several miles to the gallon more, and that's the way I'm fixing Lyme disease. And Lyme disease is, like I said, it's rampant because we have not an epidemic of ticks, but an epidemic of surgeons.
So how do you fix Lyme disease? What do you actually do?
We do what's called neural therapy, which is we go after the nerve areas, and I go after what's called the obstructive areas, the interference fields. The human body has 5 diaphragms. We have a diaphragm in the pelvis. We have the diaphragm that you normally know. We have a diaphragm in our throat. We have 2 in the brain. That the whole body is constantly pumping and expanding. If you cut it and if you have scars, that's adhesions and stops those pumping. The first thing I do is get that body pumping again. I treat the scars. I treat the nerve roots called neural therapy. We actually go in and treat the nerves that are feeding the tissues to try to liven them up. And then we do osteopathic manipulation. We start to get the body opened up and pumping again. And as soon as we treat the scars and get it pumping again, lo and behold, the patient's working on now more cylinders, and they feel better almost instantaneously. The blood, I take a drop of blood beforehand, I take a drop of blood afterwards. You can see a change. And the patients are sitting there in the office next to me saying, "Am I really feeling that much better, doctor?" Yes, you are. Yes, you are. And it's, if you think about what's the biggest injury you can have, someone putting a knife into you. Yeah. Just because it's done under anesthesia, if I cut your gallbladder out behind 7-Eleven, you knew how you had a problem. But doing it in the OR, you think, oh, no big deal. Yeah. It's a big deal. The body doesn't recognize whether it's behind 7-Eleven or it's in the OR. It knows it was stabbed and cut.
Yeah, I've been pretty lucky myself. I was in a fire once, which was the only time I was in a hospital, which was one of the good times because they did skin grafts and all that. But it took me...
medicine is good.
Yeah, it took me a while to get over that. And it made me realize that there is an important balance. I guess that's why we should call it complementary medicine, to be a little more palatable to the allopathic people. But there's a time and a place. If you break a leg or something, there's a time and a place for that.
Yeah, that's what I call crisis medicine. And I don't throw the baby out with the bathwater. And integrated medicine, I can integrate them, but they can't integrate me. Okay? They look at me as an outcast, and anything I'm talking about, why would anyone do that? But I understand their medicine. I understand acupuncture philosophy. I understand osteopathy. I understand a lot of different things. Traditional medicine only understands pharmaceutical treatments and surgical treatments. That's all they're taught.
So, when I look at what you've done almost by yourself, what do you think is the future of this if it would actually open up and we'd get funding and where they would give grants to young medical students to look into what you're talking about? Where do you think the ultimate place is that this is headed towards?
Well, I think the future is going to happen very soon. I'm setting up a program that if you had a microscope, I'll be able to view it with you. You'd be able to go into the database that if you had a hepatitis C case, you can be able to look at who else is doing what with hepatitis C. I want to set up an international educational and research foundation without walls. I think looking at the inner life is going to be the future. Edgar Cayce, America's most prolific psychic, said, the physician of the future, from one drop of blood, will diagnose the condition of the entire physical body. He said that in the 1930s.
Yeah.
Okay. And I think we're really heading into that now. More people are looking at it. They don't understand it enough yet, okay, because there's not enough teachers out there. My teachers have passed away, and it's a real problem that I have. But I really want to set up that so if someone's got a microscope in Georgia, we can communicate.
Are you taking anybody under your wing and being the protege?
Well, we're starting that now. Again, this is my program this year. We're setting up that program up. I now have a couple people that are interested with microscopes to tie into that. I will be teaching a class at this Biomedics, BIOMEDX. They sell the best microscope in the country. In March, I will be teaching a class on people how to look at the microscope and understand the holographic nature of the being. And then, most importantly, how to look at the blood and how to manipulate the blood. And my teacher said, always remember, if I can manipulate the blood, I can manipulate you.
Right.
And with my remedies, I use a lot of live germs for remedies called isopathic remedies. I have a live form of penicillin that if you had pneumonia, we'd knock it out of you within 24 hours on you. I have remedies that if you had a heart attack, we can open up the circulation, make a red cell so elastic and so smooth it'll squeeze through the tiniest capillary and open up the circulation. I've broken heart attacks right on the spot, and I've had cardiograms to prove that too.
Yeah, this is pretty amazing, Harvey. So, when I look at things like the universe, for me, it appears like we live in a conscious universe, down to the sub level of even below matter, into the field, the quantum field, Planck's field, superstrain field, whatever you want to call it. There seems to be a consciousness there that is consistently and constantly trying to communicate with us. Do you think this is one of those forms where not only our bodies, but down on the cellular blood level, where the universe is trying to communicate with us?
Oh, without question. Without question, it's all tied up in there. We're affected. The change in the weather will affect us. The universe is affecting us. Your emotions will affect us. All of this. And the blood will change instantaneously. If I came in and told you, I found something really a problem, your blood would change. You'd get frightened right away. Your blood would change instantaneously on the spot. And we've even tested it, that we'll take a drop of your blood, put it on a microscope, take you in another room, treat you, and your blood on the slide changes.
So how much of what you do, Harvey, is intuition, and how much of what you do is an actually validated, teachable subject?
First of all, none of it's intuition. I ruled out intuition. I didn't trust myself. I was doing the blood stuff, and I was doing this muscle testing called kinesiology. And after about a year, I found no patients with cancer because I didn't want to see cancer, so I couldn't find it. Okay, I was involved in the picture.
Right.
So I stopped using my intuition, and I'm completely objective. I do testing using a third party that's very objective the way I do the testing, and I rule out my intuition. I do everything by fact. I look at the blood and try to match the blood to the patient and tell me what's going on, and that doesn't. Intuition's false, and because you can be, you don't want to tell a patient they have cancer.
Right.
That's simple. Okay, so I do not use intuition. I use pure fact. If I can't figure out something, you'll hear me mumble under my breath.
Right.
Okay, what's going on? What's going on? And I'll get frustrated until I figure it out.
Well, that's good because that makes it a teachable subject.
Yes, it is. It's very teachable. It's very teachable, and my goal over the next 2 years is, I wrote the book on it, but now my goal is now to teach people over the next 2 years and link us up to have that international network without walls that we can all link up our microscopes into the same databases. So, you can figure out who's doing what for hepatitis C. Someone in Brazil is doing hepatitis C. It's got a microscope, and you can figure out right there they got what they've done, so you can get ideas. That's a communication. And then I want to hold webinars that way too. We're going to set that up. So, if you had a microscope and you had questions, Let's view your microscope. Let's everyone else view it, and let's ask the questions, and let's see if we can brainstorm it. The problem is, like I said, my teachers have passed away, so we have to brainstorm a lot of things, and I want other minds into it because I don't have all the answers.
Yeah, no, nobody does.
Nobody does.
Nobody does.
But it's the new beginning. Looking
Yeah.
at the blood to me is you're looking at the actual life in action, okay? And that to me that's the future.
Well, I'll get some important links from you to include in this information in the article and all that. And we'll see what we could do about helping you in any way we can, Harvey.
Good, because like you said, Lyme disease now is an epidemic, but it's not an epidemic by ticks. I've got now enough proof that it's an epidemic of doctors doing too much surgery.
Yep.
To me, you got to look at surgery as an attack with a knife. If you look at it, it's a legal attack with a knife. If you look at it that way, you're going to really question, wait a second, do I want my prostate taken care of? The woman say, do I want that hysterectomy? No, you really don't want that hysterectomy. That's an attack with a knife.
Yeah, and it's usually your body just trying to tell you something to get you to pay attention.
That's what it is. That's what a symptom is. If you have diarrhea, what medicine does today, if you have diarrhea, they stop it up. Well, that's crazy. The body is flushing it out. It stinks. It's awful. Why would you want to stop it up? Help the body clean it up.
Right.
I could tell you some stories about that, but it's a little too colorful.
Well, we have a long human history of killing the messenger, so.
Yes. And we blame everything on the germ, and it's not the germ at all. It's the stagnant pond that the germ is living in. That's the story. It's not, we are just germs that have organized into a physical body. We're just germs. We have billions of germs in us. All of a sudden we say this one germ is nasty and the other couple billion are fine.
Right.
Come on, give me a break. Look at the rationale behind it too, but it's the whole germ theory. Even Pasteur, who came up with it, on his deathbed recanted and said he was wrong. It's not the germ, but it's the terrain, the body it lives in that counts.
Right. Well, I wish we could take this whole teaching to our macro world, because it seems like we handle our relationships with other religions and nations and everything else the same exact way that we handle our medical symptoms. We attack it with an aggression.
Yes. And it's, everything is symbiotic. Nature is symbiotic. It works together in a plan. You don't see a fat deer. It's only humans that have really abused nature.
Right.
I think God gave humans free will because God's got a sense of humor, personally.
Yeah, the only animals I've seen that are overweight and stressed out are the ones that hang around humans a lot.
That's right.
Yeah, dogs, cats, things like that.
Deers, they will actually urinate on their food, then come back an hour later and eat it. Okay, and the Chinese do urine therapy. Urine therapy it's a waste product, but it's very honestly, it's our own vaccination.
Right.
Okay, it's the concept of drinking it, what the Chinese do, is pretty offensive, but it doesn't make sense, to tell you honestly.
We have so much to learn, Harvey.
We have so much to learn. Again, we're 100% failure, so what makes us experts? We're just brainwashed on TV that experts say this and experts say that, and everyone's in a fancy white or a green outfit, with masks on, and they look special. And that's all just blown up propaganda. That's all it is.
Yeah, sometimes I think learning is obviously the goal, but I think unlearning is the problem that we're up against. It's hard, it's difficult to unindoctrinate a person. When they've been indoctrinated in and they've bought into the system and they're so identified with it that their blinders and filters go up, and it's hard to break that away.
We've been brainwashed. And someone said to me, a dentist said to me one time, he says, the average doctor lives 4 years less than the average person. You know why? Because deep down they know they're full of garbage.
Yeah.
Okay, they know. I was suicidal, and here I was. I was a nice Jewish boy becoming a rich doctor, and I was in practice now for several years, and I was really suicidal because my patients never got better. No matter what I did, they were not happy. The only thing that worked was crisis medicine, but anything else, if I did surgery on him or something like that, I may have improved something, but you're never the same after someone cuts you with a knife. And people think, well, you're going to be better. No, your functioning is down. Your overall functioning. Your uterus may not be bleeding, but your overall functioning is down.
Right.
Yeah, and it was very depressing being a regular doctor because, like I said, people never got better. And once I started to find a way to get people better, that now my practice is, I have so much fun. People come in limping, they walk out not limping. I've been playing with stem cells for about 10, 12 years now. My first case with stem cells was an autistic gal who recently graduated UC Davis with honors. Okay, we pulled her out of autism. She was born 7th month intrauterine. She never fully developed. As soon as we gave her human stem cells, she just woke right up. She finished college, and she's now engaged and doing great. Stem cells are the future.
Oh, yeah.
I've done a lot of work with them. The French make stem cells from pigs that you can drink. We make it so fancy, you got to do all this fancy surgery and drill it to your brain. No, the French make brain stem cells you can drink. Gets in through the mucous membranes of the mouth. They're so far ahead of us, but we're controlled completely by the pharmaceutical industry. That's one of the reasons. Until the pharmaceutical system can do it and advertise it, we'll never see it.
Yeah, it's funny when you look at our system, it seems like because follow the money, the old thing. It seems like the pharmaceutical companies, the medical association, that whole body of organizations and people can only make money. They don't make money if you die, and they don't make money if you're completely healed. They only make money by sort of keeping you in the middle and not quite healing you, but not quite killing you either.
They make money on disease. I tell people, you go into a doctor's office now, and he's got drool coming out of his mouth and a knife behind his back. He can't wait to find something to do to make his living.
Well, I can see why you ruffled some feathers, Harvey.
Yes. I seek the truth. Okay? I took an oath. My oath was to help people. My oath was not to serve the system. Okay?
Yep.
I follow my oath, and I follow, the patient comes into me, they're paying me to help him. So, that's what I do, and it's a very rewarding practice when you can do that.
Yep.
My biggest problems are, and it's actually my most exciting, is when a patient comes into me and I can't figure out what's going on. Now I spend all night long thinking about your case until I come up with an answer.
Yeah, you look like the kind of a person that's up for a challenge.
Yeah, that's what it is. I love a case that no one else. I specialize in what I call Mayo Clinic failures. Okay,
Right.
I love cases that come to me that everyone else has failed on, and it's up to me. The buck stops with me to figure out what the story is, and that's if I can figure out. I get just about as much joy as the patient. I get so excited sometimes in the patient. I hug them and stuff. How many times you go into a doctor's office and hug them?
Never.
Never. I do that. Patients hug me. I love it. It's so much more fun to practice that way.
Well, the next time we come in your area, I'm going to give you a call, and maybe we can meet and give each other a hug.
Okay, definitely. And when you see your blood live, you'll be so amazed at it. You'll be entranced. I'll have a screen in front of you. I look in the microscope. You'll have a TV screen in front of you. You'll be entranced of what you see and the things that you see in your blood.
Well, we'll definitely get together, Harvey.
Good. I look forward to that.
Yeah. Thank you for your time.
Oh, you're very welcome. It was a real pleasure.
So that's where I'm going to end it.
Okay.
And I'm really thinking, I don't know if you've seen our last issue, but it's about are we alone in the universe? Because we had so many people of our readers for about 3 or 4 years now asking us, hey, why don't you do an issue on what's going on with the government cover-up and disclosure? There's like almost 500 people now, top military personnel, flight attendants, flight control tower people, government people, a couple of generals, and they're all saying the same thing. Hey, we need to be let out of our non-disclosure contracts because what's going on with the government and an advanced race of beings and UFOs needs to come out. And now I think France, Italy, Germany, Brazil, Belgium, about 3 or 4 other countries have opened their UFO files, and it's pretty revealing, some of the photographs and the dealings. So, but our next issue, we sort of want to focus back on health. So we're really thinking about doing a really nice thing with what we're doing here with you and what you're doing. So I'll be in touch with you again on that. And I don't know if whether I'll transcribe this or have you write an article. I'm not too sure.
Okay, I'm a good writer. I love writing things. That keeps me busy. By the way, if there's a book, if you go to my website, which is www.drbeglesen.com,
right?
If you go to my website, there's a book that you can pull down.
The medical conspiracy?
Yeah, the U.S. medical conspiracy.
Yeah, I'm already just about ready to do that. Matter of fact, I'm ready to click the download. That'll
tell you the truth, and it's really scary.
Yeah.
It's really scary. Like I said, if they can pick my 28 cases out of my several thousand, okay, the spying on you, and if they're spying on me there, the spying on you there also.
Right.
Yes. Very scary. We do not have a free system. We have, I think it's a much more what I call a fascist control system.
Well, right now, I don't know if you've been keeping up with the NSA, the National Security Agency, but right now, everything that we've said, all of our emails, all telephone conversations, everything that goes into the airwaves or across the wires goes through their system now. And when you see a picture of their computer array, it like starts out and disappears off into the distance, row after row after row after row. And they're not only recording everything, all text messages from students and teenagers, everybody, but they're archiving it. So everything is being said, and they have these algorithms that can go in there and pick out words or phrases or even slight intentions that are people talking about something. It doesn't seem like they're talking about what they're talking about. It can even pick those out. So we need to really pay attention right now to what's going on.
It's very frightening. In fact, I'm now going after, through the Freedom of Information Act, my Medicare records. How did they find those 28 cases out of my several thousand files? It's got to be there someplace unless they burn the records. But I'm sure they're not bright enough to burn the records as much as they're archived them. So I will know in a short period of time the exact story of why they came after me and how they came after me.
Well, that'll be an interesting one to find.
That'll be very interesting. I'm very excited about the potential of that.
Yep.
I'd be very disappointed if those records were destroyed. But
you would be surprised what they don't destroy.
That's what my thinking is.
Yeah,
I think they're too omnipotent.
Yeah.
That they wouldn't think of destroying them because they're just that omnipotent.
Right. All right, Harvey, I'll let you get back to your day.
Okay, it's a real pleasure.
Again, thank you very much.
Oh, you're very welcome. I enjoyed the heck out of it.
And the person that's working with you, Justin?
Yes.
Yeah, he's really cool, man. He did a lot, and he's really a personable person to have working with you.
Justin, we've been together for, probably about 30 years.
Really?
And he knows my work, and he's a good promoter of it because he really sees the truth.
Yeah, he was right on top of this.
Yeah.
All
excellent.
Right.
Okay.
Okay, you take care.
You too. Okay, bye-bye. Have a good one.
Bye.